Good day, everyone. My name is Peter. I'm one of the pharmacy students here at BPC, and today we're going to be talking about gastroesophageal reflux disease, or as you might know it as GERD. Just quickly going over the agenda for today. The goal of this presentation is to give you guys some general and practical information on GERD. I'll do my best to make the information relatable and digestible. So we'll be going over the background of GERD, some of the signs and symptoms you might experience if you have GERD, some of the complications if you leave it untreated, some of the diagnostic tools, the treatment options, as well as what medication you can use to help you with GERD. So what is GERD? Well, it's a stomach reflux that causes problematic symptoms and or complications other than normal acid reflux. Now, it is normal to have some acid reflux after like a large meal. However, when it keeps happening, then your stomach acid will start to cause damage to a lower esophageal sphincter, which is a valve that separates your esophagus from your stomach. And that's when some of the symptoms of GERD starts occurring, such as like heartburn, regurgitation, and acid reflux, which we'll be going over in more details in another slide. But for now, I have a video that goes over the idea of GERD.
When you swallow food, it travels through a tube called the esophagus. The esophagus leads into the stomach through a hole in a sheet of muscle called the diaphragm. There's a round muscle at the bottom of the esophagus that works like a valve. The muscle relaxes when you swallow, allowing food to pass into the stomach. Certain cells in your stomach, called proton pumps, release acid to help digest the food. The lining of your stomach protects it from the acid. The esophagus has a different type of lining, which looks like it's made of smooth tiles. The valve is designed to close tightly after you swallow, so nothing comes back into the esophagus. Your diaphragm is also meant to pinch securely around the esophagus, closing off the opening to your stomach. It's normal for a small amount of acid to occasionally splash into the esophagus. This is called reflux. That word means flowing back. A small amount of reflux doesn't usually cause any harm. But if acid splashes up into the esophagus over and over again for years, the esophagus can be damaged. There are several reasons this might happen. It's not uncommon for the valve to become weaker, so it doesn't close tightly. That allows acid and partially digested food to come up into the esophagus. Sometimes the diaphragm weakens around the esophagus, allowing the hole to become larger. This hole is called the hiatus. When it becomes larger, part of the stomach may bulge through it. This is called a hiatal hernia. The hernia may cause the esophagus and the valve to move up. In that case, the diaphragm is no longer reinforcing the valve. That makes it more likely that acid will get into the esophagus. When acid and food splash up into the esophagus repeatedly, it's called gastroesophageal reflux disease, or GERD. Gastro for the stomach, or gastric system. Esophageal for the esophagus. Mayo Clinic's Division of Gastroenterology and Hepatology is recognized as
Hopefully that previous video gave you guys some good insights on what you expect when you have a GERD. So, as you might know, GERD is a very common disease around the world. Approximately 10 to 20% of the Western population has a different severity of GERD. Some maybe in the earlier stage, some in the later stage. And it's a lot more common in individuals over 50 years old due to having more acid reflux over their lifetime. Fortunately, it is a disease that can be treated and managed with early detection. Though it is worth noting that GERD is less common in the Eastern countries simply due to our dietary differences. The one phrase I like to use is they eat more rice, we have more fries. Some of the causes and risk factors include being overweight or obese, as well as being pregnant, as these will put more pressure on your stomach, causing more acid to flow back into your esophagus. If you just think about how physiology works, smoking, alcohol use will also attribute to acid reflux, as well as numerous other diseases. Next up is eating acidic food, so food such as like citruses, so like oranges, grapefruits, chocolate, caffeinated beverages, so coffee, Coca-Cola, as well as fatty foods, spicy food. They will all attribute to acid reflux and later down the line, GERD. Overeating is another one, since having more food in your stomach will increase the likelihood of your stomach acid overflowing into your esophagus, which is why we generally recommend having multiple small meals instead of one large meal. And lastly, taking certain medications will also increase the likelihood of developing GERD later on in your lifetime. So some of these medications include like aspirin, NSAIDs. I have a slide later down the line talking about it, so look forward to that. So here are some of the common signs and symptoms of GERD. Number one on the list, believe it or not, it's acid reflux, which is when your stomach acid splashes back into your esophagus, as you see on the video. Again, this symptoms is normal and can happen to anybody after having a large meal or if you lie down after a meal. It is only problematic when it frequently occurs with normal food intake or if it is associated with some of the other signs and symptoms listed here. Next up is heartburn. It is described as a substernum or below the rib chest pain. And despite what the name suggests, it's got nothing to do with the heart. This can often be mixed up with angina, which has more to do with your heart. Now, the causes for heartburn is usually due to acid reflux, and the pain is originated from stomach acid causing damage to your esophagus. So the pain is from your esophagus. Indigestion is a relatively vague term, and it is described as early fullness or uncomfortable fullness of your stomach that lasts longer than usual and sometimes is accompanied by nausea. So just think of a time when you were eating buffet or something and you just had way too much food, but you still want to finish whatever is left on your plate, so you end up overstuffing yourself. And after you leave, you're just sitting in your car with regret. Why did you just do that? So that's kind of what indigestion is like, except after you eat like a normal amount of food and you start feeling those early fullness or uncomfortable amount of fullness. This can also happen if you don't chew your food thoroughly enough or properly. Next up is regurgitation. It is the action of regurgitating undigested food. It's usually due to frequent acid reflux, along with poor eating habits, such as eating too quickly or eating too much at once. Going back to the idea of overeating is bad for you. GERD patients tend to have a higher risk of having regurgitation due to having an increased amount of acid reflux, though normally it shouldn't happen. And lastly, for nausea and vomiting, it is a very rare symptom for GERD itself. The symptoms itself can be caused by a large variety of other diseases, so they're not very GERD specific. And generally, they only occur at later stages of GERD, where indigestion and regurgitation occurs with nearly each meal, or if the GERD is left untreated for too long. So what happens if you leave GERD untreated for too long? So here are some of the things that might happen. Number one, esophagitis. It's the inflammation of your esophagus. So when your esophagus is repeatedly exposed to acid, it's going to cause a lot of inflammation. Just think about what happens if you accidentally pour acid on your hand. It's going to sting a lot, probably. and that's what's happening to your esophagus when you constantly get acid reflux. Next up, it's GI bleeding. GI bleeding may have numerous possible causes. However, GI bleeding associated with GERD generally is due to repeated acid exposure of your esophageal lining, causing damage to the outer layer of your cells, resulting in bleeding from your esophagus. Now, some of the signs and symptoms of that you might experience or you might see include dark or black colored stools, or if you're coughing up or vomiting blood. Those are usually signs that you should probably visit the ER. And since it is an acute condition, you should see medical assistance whenever you do have an active GI bleed, whether it be your primary care doctor, the doctors you see here, or emergency if you're at home. Next up is what we call Barrett's esophagus. So Barrett's esophagus is a precancerous condition that occurs in patients who has GERD or other precipitating factors for multiple years. Since it can only be diagnosed via endoscopy, I'll be going over what endoscopy is in the next slide. It is often not diagnosed until an individual is in their 50s when they get their first endoscopy. And it is characterized by abnormal cell growth in the lower portion of the esophagus due to being repeatedly damaged from acid reflux. While this is a precancerous condition, most people that have Barrett's esophagus do not end up getting cancer as long as their GERD is being properly managed or treated. And last but not least, esophageal or stomach cancer is the last in line in terms of complication associated with GERD. It is very rare and will really only occur if an individual has neglected their GERD for a long time and cancerous cells begin to develop from your esophagus. Some of the signs and symptoms include worsening of your GERD symptoms, like your heartburn is getting worse, you're getting more regurgitation and more nausea, vomiting. You might experience weight loss that when you wasn't even trying to lose weight, or having difficulty swelling, which is when there's enough cancerous cells deposit in your esophagus where it's starting to obstruct how you're swallowing food. In terms of proper diagnostic tools, endoscopy is really the only proper diagnostic method. So the doctor will put a camera down your esophagus through your mouth and see what is going on. See if there are any damages to your esophagus wall, any inflammation, any abnormal cell growth, etc. So looking for signs and symptoms of Barrett's esophagus and stomach and esophageal cancer, like what we mentioned before. Most of the time, it's not required. This procedure itself is not required for the doctor to start prescribing you medication to treat GERD, though it is recommended for anyone over the age of 50 with signs and symptoms of GERD or signs and symptoms of GI bleeding or stomach bleeding to get an endoscopy every 2 to 3 years to ensure that if there is something, it can be treated early rather than late. So here are the treatments for GERD. In terms of the management of GERD, lifestyle changes are one of the most effective methods in managing GERD. Regular exercise, ideally 3 hours per week, and weight loss has long-term benefits in your overall health on top of just managing GERD. Smoking cessation is another one of the lifestyle changes that will provide you with lifelong health benefits. Wearing loose fit clothing, especially at night, will help relieve some of the symptoms of GERD, such as heartburn. And lastly, changing your sleeping habits will help manage GERD by preventing nighttime acid refluxes. as well as avoid eating 2 to 3 hours before bed. These will prevent acid production right before bed, which is going to fill up your stomach and have a higher chance of causing more acid reflux. When you lie flat on your back, your stomach acid are more likely to flow back into your esophagus. So think of your stomach as like a water bottle. When you put it on the table sideways with a leaky cap, the water are going to spill out, which is why sleeping on your left side or on an incline allows gravity to keep your stomach acid down. Now I have a video coming up that will give you a graphic representation of how it works, so you have a better understanding of what it looks like.
Many of my patients suffer from acid reflux disease. They especially experience symptoms after consuming a large meal, when bending over, and most often during the night when lying in bed. This is caused by acid in the stomach flowing back into the esophagus when you are no longer in the upright position. You may try raising the head of the bed to limit the acid flow, but it can be uncomfortable for sleeping, offering limited benefits. Our research has found that when you sleep on your left side, there's way less reflux from the stomach into the esophagus compared to sleeping on your back or right side. This is because your stomach is not symmetrical, but actually on an angle in the body. When lying on the right side, part of the stomach is above the esophagus, making it easy for gastric acid to flow back. The same is true for lying on your back. However, sleeping on the left side ensures that there is a natural protection against reflux due to the shape of your stomach and position of the esophagus. Typical symptoms of acid reflux, such as nighttime heartburn and regurgitation of gastric acid, which can be very uncomfortable, painful, or even create the feeling of choking at night, can be avoided by simply sleeping on the left side.
Dietary changes are another step of lifestyle modification that you can do to help manage GERD. So you want to aim to eat smaller but more frequent meals while avoiding large meals, since overstuffing your stomach will cause more of your stomach content or stomach acid to flow back into your esophagus. You want to avoid lying down after eating, again going back to the idea of adjusting your sleeping habits. Same idea. You want to avoid heavy exercise right after you eat, since blood will flow into your muscles rather than your GI tract or your stomach, thus decreasing how fast you digest your food. On top of that, exercise immediately after you eat will cause your ab muscle or your stomach muscles to squeeze your stomach in a way that may even cause you to throw up. Other than that, avoid stomach irritating beverages, such as like alcohol, coffee, tea, or any carbonated drinks. And lastly, avoid acidic food, so foods such as like citrus fruits, so oranges, grapefruits, tomatoes, which include tomato sauce or pizza sauce, alcohol, again, chocolate, and if you're not sure, you can always just look up something acidic. Now, since increasing the acidity in your food will cause more damage to your esophagus when you do get an acid reflux. Now, I know it's difficult to completely cut out some of these foods from your daily life all at once, so start small rather than completely stopping everything. And also aim to eat more alkaline or basic food, such as the ones I listed here: oatmeals, lean proteins, so like your red meat, bananas, green vegetables such as asparagus, broccoli, spinach. They will decrease the acidity of your stomach content. Now, in terms of medications used to treat or manage GERD, there are really three major classes that I'll be going over. So the proton pump inhibitors or PPIs, the H2RAs, and the antacids. They're the most commonly used, and they're all purchasable over the counter and does not require a prescription. With that said, each of these medications does come with its own set of precautions and side effects, so if you're not sure, always talk to your doctor or ask a pharmacist. So first up on the list, proton pump inhibitors, also known as PPIs. They work by limiting the amount of acid produced in your stomach, and less acid means less acid reflux. Thus, you do want to take this medication before you eat. Comparing this to the other two drug classes mentioned, which is the H2RAs and the antacids, PPIs has the longest duration of action, which means it will stay in your system for the longest, which is usually about a day, for 24 hours. However, it also takes the longest for it to start working after you take it. So it takes about 2.5 hours before it starts working after you take it. They are technically stronger than H2RAs in terms of limiting acid production. However, they do have more side effects associated with long-term use, which is why I would recommend discussing with your doctor or at least your pharmacist first before starting on this medication, even though they are available over the counter. Again, PPIs are generally once-a-day dosing, so you take one capsule or one tablet once a day. However, if you are experiencing symptoms overnight, you can also take another dose at bedtime. Now, if you do take it over the counter, the general recommendation is to take it consistently for at least 2 weeks and do not take it for more than 8 weeks without consulting your doctor first. Now, some of the examples for PPIs listed here are the omeprazole, pantoprazole, lansoprazole, esomeprazole, and dexlansoprazole. The ones that you're most likely going to see or find over the counter are the Prilosec, Prevacid, and Nexium, which are the ones I highlighted. The other two are mainly on prescription. PPIs are generally well tolerated with short-term use. However, taking higher than recommended dose or taking for extended period of time, such as more than 1 year, puts you at an increased risk of fracture, as well as osteoporosis, which is the weakening of your bones. Other side effects with long-term use include infections, as well as other issues or diseases associated with your esophagus. Now, for these side effects, the elderly population should be extra careful since they are way more prone to some of these side effects. Thus, it is recommended to consult your doctor first if you are over the age of 65 before you start on this class of medication. And lastly, for all drugs, including this one and the other two that I mentioned before, remember to store it in room temperature and away from moisture. So our second drug class, the histamine 2 receptor antagonist, also known as H2RA, they work similarly to PPI by limiting acid production in the stomach, but they target different receptors. Now, they're much shorter acting than PPIs and usually last about 4 to 10 hours, which is why sometimes you might need to take 2 doses throughout the day. It works best when you take it 10 to 60 minutes before you eat, and they also act faster after you take it, so it takes around 15 to 20 minutes before they start working after you take it. Some of the examples of H2RAs that you might find include famotidine, which is commonly seen over the counter, and cimetidine, which is really only on prescription. In terms of side effects, this medication is pretty well tolerated with practically no side effects unless you overdose. And again, store at room temperature and away from moisture and direct sunlight. Last up on the list is the antacids. Comparing this to the other two classes mentioned before, antacids works much faster than the other two. With that said, they also has the shortest duration of only 30 to 60 minutes, and which is why you can take it up to 4 to 6 times a day as needed. They work by directly neutralizing the acid in your stomach, so you can take it after a meal instead of before a meal. Though it is really only used for symptomatic relief, so it treats the symptoms, but it is not a chronic treatment for GERD in general. Some of the examples listed here include calcium carbonate, which you might know as Tums, magnesium hydroxide, also known as milk of magnesia, sodium bicarb, plus aspirin, also known as Alka-Seltzer, all three of which are available over the counter. And if you have questions on which one you should be using or which one is best, talk to your pharmacist. Now, some of the side effects for these include unpleasant taste, constipation, increased risk of stomach bleeding or GI bleeding if used too frequently. So on the topic of medications, here are some of the drugs that could make GERD worse. And if you happen to have GERD or frequent acid reflux, it is recommended to avoid these drugs whenever possible. The ones I highlighted down here are some of the most common ones that you might see used since they're all over-the-counter medications. For NSAIDs, if possible, try to use acetaminophen or Tylenol as an alternative, since NSAIDs are usually used for pain management. And if you absolutely have to take NSAIDs for whatever reason, say if your doctor prescribed it, or if Tylenol is just not working out, try to use the lowest possible dose for the shortest amount of time. Now, next up, aspirin does not really have a safer alternative. However, I will always speak to your doctor first before starting on aspirin, since using aspirin when it's unnecessary will only bring more harm than benefit. Steroids are usually not as big of a concern since they are prescription only. Your doctor is not going to prescribe these unless you absolutely need it. And even then, treatment duration is not long enough to be a concern for GERD at least, though you may experience more acid reflux while taking steroids. Nicotine replacement therapy is an interesting one, since it is used to help an individual quit smoking. And as I mentioned before, smoking is a large risk factor for GERD. Thus, between your two options, nicotine replacement is a better choice. And lastly, iron supplements are more commonly used in the female population, since they're more likely to experience iron deficiencies. With that said, there's really no safer alternative for iron supplements, and if you need it, you need it, since not taking it will only make some of the other symptoms worse. Now, focusing on some of the stuff I highlighted, for NSAIDs, you really are only concerned about the over-the-counter Motrin, Advil, Aleve, since they're the most commonly seen. Celebrex and Meloxicam are prescription only, and your doctor most likely will not prescribe those to you unless you absolutely need it or have an indication for it. And aspirin, as we talked about, it doesn't have a good alternative, but if you need it, you need it. So we're reaching the end of this presentation. Hopefully everyone's able to learn a thing here and there. If not, here's a quick recap. So GERD is a common but treatable disease, and it can cause serious complication if left untreated or unmanaged. Lifestyle and dietary changes are the best way to manage GERD, and all common medications therapy are accessible over the counter. And lastly, avoid unnecessary medication that may cause or worsen GERD. Now I have prepared 2 self-assessment questions just to see how you guys did, see if you guys learned a thing here and there. So the first question, what is the first step in trying to manage GERD? A, PPIs, 2, H2RAs, C, antacids, D, lifestyle changes, or E, immediately seek medical assistance. Now, if your answer is D, congrats. Now, going over some of the other options. So A to C are all your medications that are helpful for GERD. However, as your first step, you want to try to manage your lifestyle, or you want to change your lifestyle whenever possible. So things like exercise, weight loss, as well as dietary changes, like I mentioned before, they should be your first step. Now, immediately seek medical assistance. Usually, I will say 99% chance it's not going to be your first step. However, if you don't know you have GERD and you happen to have like a stomach bleeding or you start coughing up blood for whatever reasons, then yeah, immediately seek medical assistance. Now for question 2, what are some of the potential causes and risk factors for GERD? A, obesity, B, smoking, C, pregnancy, D, alcohol use, E, smoking and alcohol use, or F, all of the above. So if you answered all of the above, congrats. So all of which are potential causes or risk factors for GERD: obesity, smoking, pregnancy, alcohol use. All of them can attribute to GERD. I tried to throw in a curveball by placing E there, but I'm sure you all got it right. So this concludes my presentation. Thank you all for participating, and thank you all for paying attention. Hope you have a good rest of your day.